Well, I have light skin, and I've foolishly was out in the sun for many, many years.
After several go-rounds with cancer, James Haggerty is protective of his skin, both in the sun and at his doctor's office.
I used to see him once a year, but I now see him 4 times a year simply because I've had several skin cancers.
Studies show diligence pays off, in particular when it comes to melanoma, the most lethal form of skin cancer. Patients who had at least one skin exam were 37% less likely to have invasive disease if diagnosed with melanoma. A professional exam should be performed during an annual checkup.
You should get into a gown, and the physician or the nurse practitioner should be examining you in a gown so that they can look at your skin, look for melanomas. Skin cancers are actually the most common cancers, and a lot of people don't realize that.
Something as fundamental as looking for skin cancer is substantial in terms of survivability. In patients who had a skin exam in the last year, 64% of melanomas were stage 0, meaning purely superficial, as compared to 46% of patients who had not undergone a skin exam.
Part of the examination should be a full head-to-toe skin exam, including looking at your scalp, looking in between your fingers, in between the toes. I've had patients develop melanomas under the nail, behind the eye and the retina.
James battles the less serious squamous cell cancer, but given his complexion and sun history, he's always on the lookout.
You have to keep right on top of them, otherwise they will begin to become serious.
As more people get an early cancer diagnosis, it's making their prognosis much brighter. For Lee Memorial Health System, I'm Amy Osher.